Hello, everyone, and welcome. I'm Dan Cooperstein, ERISA attorney and SVP of Compliance at Corporate Synergies. I'm streaming live today from my home, which for many of us is the new norm as we try to do our part to mitigate the spread of the coronavirus. I, along with my team, help employers navigate the complexities of employee benefits compliance. And things definitely just got much more complex in light of all of the new rules and regulations out there. So hopefully I can make some sense of all of this for you. And thanks for checking in, and hope everyone is safe and well out there. So today I wanted to review three topics. First, the House coronavirus bill. Secondly, new state and local leave and insurance laws. And third, new telehealth guidance from the Department of Health and Human Services, or HHS. And since things are really so fluid right now, I think it's best to update you on items, as it's necessary. So definitely be on the lookout for more updates in the future on our resource page, found at corpsyn.com/coronavirus. Definitely check that out, and let's go ahead and get started. So early Saturday morning, the House passed an emergency relief bill designed to address the effects of the coronavirus and cushion the economic blow to vulnerable Americans. In its current form, the relief package is designed to ensure that working people are able to access coronavirus testing and that they get paid leave should they become infected with coronavirus or need to give care. And just to focus in a little bit more and get a little more specific with regard to the benefits and leave and insurance matters that we talk about here. Let's talk about those highlights of the bill first. So first of all, it makes coronavirus testing free. So the bill requires that private health insurers plus government programs like Medicare and Medicaid cover the cost of testing, including emergency room visits and doctor fees associated with such testing. And also that the testing provisions cover Americans without insurance. So that's an important component of this new law. However, that being said, the treatment for the coronavirus will not be free, and there's nothing that's in the bill as it currently stands that would address treatment for the uninsured who become infected with coronavirus. So let's talk about emergency paid sick days. So and just before I go into some of the details here, I realize there's a lot of details to be talking about just in a quick briefing here, but there are some different versions out there. But the following is still our understanding as of now, and I just checked out the Congress.gov website a little after noon today. So things may be changing right now as I speak. So what I'm saying may not be exactly how it ends up after the Senate reviews it. But in the emergency paid sick days apply in the event of a public health emergency like coronavirus. The bill gives workers 14 days of paid sick leave to be available immediately during the coronavirus, which of course, many employers are already asking their employees to work from home for that amount of time. The bill ensures that sick time is offered to those impacted by quarantine orders or those who must stay home to care for children. It also reimburses small businesses with 50 or fewer employees for the cost of the 14 additional days of leave. Additionally, in the event of a coronavirus-related emergency, the bill would create a new federal emergency paid leave benefits program for those unable to work because they have coronavirus, are quarantined, are caring for someone with the disease, or are caring for a child due to coronavirus-related school closings. And under those provisions, eligible workers would receive benefits for up to 12 weeks based on the most recent language I saw this afternoon, at least. And the benefit amount would be 2/3 of the individual's average monthly earnings, up to $4,000. Those receiving pay, that is, those receiving regular wages or unemployment compensation directly through their employers would not be eligible for that. Additionally, that benefit amount described above, the benefit amount I just described, would be reduced dollar for dollar by each dollar of private paid leave or state paid leave that those employees had received. So just some notes there. We'll still see how this could pan out. Might be a little bit differently. Might pan out a little bit differently. Workers would be eligible for such paid leave through the rest of 2020. One thing here, the definition of a covered employer. for these for the purposes of these paid sick days and paid family leave provisions is defined as employers with fewer than 500 employees. And while the bill does not apply to businesses with under 50 employees, while the bill does apply to businesses with under 50 employees, the Labor Department would have the option of exempting those businesses if it determines that providing paid leave would jeopardize the ongoing viability of the business. So, a lot of limitations there and exceptions, and a lot of the media attention that has been writing about the bill has been a lot of that media attention has been focused on the 14 paid sick days and the paid family leave components of the bill, with the criticism being that those components of the bill are only expected to affect approximately 20% of U.S. workers, and as a result, big employers like McDonald's, Amazon, and Whole Foods would not be required to provide any paid sick leave at all, which I think is a little concerning for people who are, ordering food, to their homes and ordering other services through Amazon. So it should also be noted that there are still some unresolved issues with regard to the paid leave. It's my understanding that today there's been some modifications to that. We're all watching those very closely. But if you actually go to congress.gov, you can actually see the links. You can actually, there's a link that shows you the current status of the bill on congress.gov. And from there, you can see how the text of the bill is actually changing right now as we speak. So we are hoping to get the final version soon. As far as next steps are concerned, the Senate has said that they will try to get this signed into law with warp speed. At least that's what Senator Mitch McConnell said yesterday. But it was delayed yesterday due to an unrelated amendment that was introduced by Senator Rand Paul. But many of the reports I've seen out there have said that the Senate is expected to be done with their review by the end of the day today, and we'll keep you posted on that. Okay, let's talk about the other big thing that I think many of our clients have been calling us about and asking a lot of questions about, which is, what are some of the laws? What are some of the state and local laws and regulations that have been issued specific to coronavirus? And how do those things impact us and our organization? There have been many of these laws passed in states and local jurisdictions across the country. So while I'm not going to name all of them here, go into all the details on all of them. They've been passed in states like California, including San Francisco, Colorado, New Jersey, New York, Washington State, and Rhode Island. And probably as I speak, there's probably more rules coming out. I did want to talk about some of those states where I know we've received a lot of questions about the laws in some of those states. In California, for example, the state disability insurance and voluntary disability insurance and paid family leave provisions have all been affected. The California Employment Development Department, or EDD, expanded the availability of benefits under these programs to employees who are unable to work due to having symptoms or being exposed to coronavirus, or being unable to work to care for a family member who is ill or quarantined. In San Francisco, employers cannot require doctor notes regarding coronavirus for taking sick days from work. In Colorado, the state of Colorado has issued a new law that allows for 4 days of paid sick leave for coronavirus and related types of leave. Fortunately for employers out there, they can use existing paid leave policies to cover that Colorado paid leave mandate. New Jersey has issued guidance. The New Jersey DOL issued guidance that explains how employees can be eligible to take family leave insurance, or FLI. In New York, just yesterday, a new law was signed that addresses the immediate needs of employees affected by coronavirus who are subject to either mandatory or precautionary orders of quarantine or isolation. And that provides for employers with 10 or less employees job protection for the duration of the quarantine order, and guarantees their workers access to paid family leave and disability benefits under the state's short-term disability program for the period of quarantine, including wage replacement for their salaries, up to $150,000 for employers in New York with between 11 and 99 employees, and employers with 10 or fewer employees. It will provide at least 5 days of paid sick leave, job protection for the duration of the quarantine order, and it will guarantee their workers access to paid family leave and disability benefits for the period of quarantine. And then for employers with 100 or more employees, as well as all public employers, regardless of the number of employees, if you're at a public sector job, it's going to provide at least 14 days of paid sick leave and guaranteed job protection for the duration of the quarantine order. I actually read through the law today. I did not see anything about any provisions about disability with regard to those larger employers, but they may clarify that in more regulations to come later. So in addition to that, so I should actually just clarify the provisions of that new New York law went into effect immediately upon passage. And so those rules are effective now. And then along with that bill, the governor also approved expanded paid sick leave provisions for the 2021 fiscal year, which will go into effect 180 days from March 17th. So, for example, employers with 4 or fewer employees would have at least five days of unpaid sick leave a year. Employers with 5 to 99 employees would get 5 days of paid sick leave each year, and employers with 100 or more employees would get 7 days of paid sick leave each year. So a little bit of an expansion that's happening there. Obviously, we could do a whole, I could do a whole probably separate thing just on all the different state and local laws, but those are some of the big ones that have happened recently. And finally, I wanted to talk about the new HHS telehealth guidance that came out. HHS issued new guidance that makes the rules and regulations around telehealth much more flexible. So specifically yesterday, the Trump administration and HHS announced unprecedented steps to expand Americans' access to telehealth services during the coronavirus outbreak. Specifically, the Centers for Medicare and Medicaid Services, or CMS, expanded Medicare coverage and payment flexibility for telehealth visits, so that it's easier for older folks and folks that they're more vulnerable participants on Medicare to fill prescriptions and get the services that they need from their doctors. Additionally, HIPAA penalties and HIPAA enforcement was relaxed through the Department of Health and Human Services Office of Civil Rights, or OCR. And so it was announced that OCR will waive potential HIPAA penalties for good faith use of telehealth during the emergency, during the coronavirus outbreak, even to certain non-HIPAA approved telehealth providers and applications. And in addition to these things, the HHS Office of Inspector General provided flexibility for healthcare providers to reduce or waive beneficiary cost sharing for telehealth visits paid by federal healthcare programs. So a lot more flexibility there. And we have links to this guidance on our CSG resource COVID-19 resource page if you'd like to see more information about these. But the reason for why this really is so important, I think, at the end of the day, is because the elderly and vulnerable participants on health plans can now feel much, much safer and more free to get their prescriptions filled, to take care of other medical situations without having to go into a hospital or into a medical care facility that's busy dealing with the extremely sick, where they can also be exposed to the coronavirus that's in the air and on surfaces. So major developments there with regard to health plans and making things much more flexible. Still, however, if Treasury Secretary Steve Mnuchin is listening to our briefing today, I would urge him to move quickly to release IRS telehealth payment guidance, because that would, I think, make it even easier to pay for these programs and to be offered on qualified high deductible health plans and other health plans. Since that is currently lacking right now, it makes it very hard for employers out there to offer very flexible arrangements with regard to telehealth. So I know, Steve, you're probably really busy out there dealing with the economic stimulus package. So it's okay. I understand. But that's all for now. I would recommend you join our Health and Welfare Compliance Forum, or HAWK Forum, on LinkedIn for notifications of our next live briefing, where we will continue to provide you with important updates and discuss some of the implications of the new rules on your benefits and leave programs. And the link can be found in the description below. Until then, be safe and be well. And thank you for joining us today.